Welcome to the Chase MedSearch podcast, the place where we dive deep into the medical device sales industry by discussing the current trends, timeless philosophies, and amazing experiences that shape our niche of the industry. Join me, Jordan Chase, on a guided tour as I speak with established sales leaders and professionals as they share stories that will help you get in, stay in, and thrive in your medical device sales career. Let's start the show. Welcome back to the Chase MedSearch podcast. I am super excited to have the pleasure of having Dr. Siraj Sayeed on today. He is a board-certified, fellowship-trained orthopedic total joint replacement surgeon, and he specializes in primary and complex total shoulder, hip, and knee replacement surgery. He's the co-founder and president of the South Texas Bone and Joint Institute here in San Antonio, Texas. And his vision is to establish the premier joint center in the South Texas region using state-of-the-art technologies combined with unparalleled orthopedic expertise. This is exemplified by the mission of his practice to personalize orthopedic total joint care with compassion and integrity for each patient. Dr. Sayeed, welcome to the Chase MedSearch podcast.
Thank you very much, Jordan. I really appreciate you taking part of your Saturday to chat with me.
Oh, absolutely. The same to you. And it is a distinct pleasure to interview friends. And we're friends.
Yes.
And our daughters are definitely great friends.
Yes, they are.
And teammates.
That is true. That's true.
Absolutely. Before we dive into the topic at hand today that I wanted to cover, let's talk a little bit about your background with our audience, because it's so special. You were a Division I athlete. You served in the military. You have an undergraduate degree, I believe, in electrical engineering.
Right.
You did your residency at the Mayo Clinic in Rochester. This is just an amazing combination of experiences. When did you first become aware that there was such a job as a medical device rep?
You know, I didn't really understand like medical devices very much and reps until I actually, like even in medical school, because you're so focused on studying, even though you're on rotations, you know, as a medical student, you don't really get exposed to the reps very much. But when you're a resident, that's where reps kind of really, the interaction was just huge because reps worked with the attending physicians hand in hand. And they knew how the attending physician did their surgeries, what implants they used, what technique they used. So we really, as residents, we leaned pretty heavily on device reps to kind of guide us and say, hey, how does Dr. So-and-so like to do his knee replacement? What implants? How do I do this? So your device reps were key to, honestly, part of your education in residency. You know, in healthcare, you always try to separate medical industry from the education piece.
Right.
But they're really intertwined because, you know, medical industry is really intertwined with healthcare now. And from an orthopedic standpoint, we do a lot of implants and plates, screws, joints, nails, just implantable devices. And you need that device rep because they're technically the expert on that device. And, you know, the physician may not know everything. And then the device rep, that's their job, is to kind of work hand in hand with the surgeon. So my exposure didn't occur until I was a first-year resident, believe it or not. And then those 5 years in residency, interacting with multiple different device reps and then learning about different devices for the orthopedic industry.
Yeah. Do you remember who the first one was that you actually knew, okay, this is a medical device rep? Well,
yeah, I actually do. And I see him at meetings every now and then. So there was a company called Link, Link.
Okay.
So when I started residency, my first rotation was pretty much one of the hardest rotations at Mayo Clinic. So I started right off with a bang. And I remember we had to round on so many patients, and at Mayo, there were so many joint replacements that were done. And as an intern, you were responsible for probably, I want to say, at least 40 to 50 patients overnight, taking care of them and making sure everything went well overnight while the team was gone. And it was kind of a wake-up call, how hard work it was going to be. But I do remember that first day coming into clinic, he introduced himself and then we chatted. And then my senior residents were there. They already knew him. But then we would have to template cases after hours. And he would come with the templates and then he'd sit with us. And I mean, we're talking about 6, 7 o'clock at night. We're doing this work. And he was motivated enough to meet us after clinic was done and then sitting and doing templating on hip prostheses, knee prostheses. So, it's funny, every resident has that same experience on this rotation. So I still remember him to this day.
Yeah. A lot of folks are so curious about the interaction between reps and physicians because at least people that I've talked to that don't really know about the medical device industry, they're like, so this person, this rep, they were in a fraternity in college and then they had like an undergrad in, I don't know, accounting. And how are they in the OR? And do physicians really respect that outsider looking in? Like,
Right. Yeah. So that's kind of a key piece because some reps, their background isn't even medical, right?
right.
So that's why the interaction between a rep and the surgeon can be a little testy at times because some surgeons are very particular. And if you don't know and you're not prepared before you go into the operating room, some surgeons like really get upset. So you have to be the expert on whatever device that you are involved with.
Yeah.
So, if your background is accounting and you're trying to sell or you're repping knee replacement, it would behoove all reps to spend time with engineers, read the white papers, talk to engineers, go to your sales training courses, understand the implants, play with the instrumentation, know your instruments, how it's done, do the procedure yourself, like on a cadaver or on sawbones, and that'll help you with regards to questions. And a lot of it is experience because you're not going to know all the questions a surgeon's going to ask you. So there are a lot of things a surgeon can ask during surgery. So, just be prepared to handle it. Younger reps usually come in with your more seasoned reps, and there's always training for it. And all the reps I've worked with, no one's ever been thrown into operating room as a novice. I think that would just be bad form.
Mm-hmm. Yeah. What, as a young resident, you're sitting there and you've met this seasoned medical device rep who's probably seen hundreds, thousands maybe of cases at this point, trained a lot of people. What were your first impressions of him? What did he do to build that confidence and trust in you that this is someone that does actually know what they're talking about?
Yeah, honestly, the time that he would spend with you, right? So he actually, nothing was online back then, right? So it's all just paper. So that first day we're templating, he actually broke out the technique manual and he walked me through the technique on a revision hip. So going through the entire manual, he brought the instruments, he brought the sets, and I could put them in my hand. So that way I understood. He's like, okay, this is step 1. This is step 2. This is step 3, right?
Yeah.
So as an intern, that actually made a world of difference. And he was just very knowledgeable.
Yeah.
He was an expert at his own device. So, I think that was the important thing.
Mm-hmm. Yeah. And Mayo is, I lived in Minnesota for a long time, like 15 years, I think. And it is a incredible place. It's world class. The reps that sell at Mayo are not average reps. Typically that is a place where the best of the best are recruited and planted there. They may come out of the Twin Cities and drive down or whatever. But when you left Mayo and encountered maybe in your career, and we don't have to name names, and you moved on and maybe encountered reps that were not as competent, can you kind of unfold that for us? Because I think maybe you're in a situation that's not necessarily reality for the rest of the country, right?
Yeah, right. You're 100% right, Jordan. Mayo is a little bit of a bubble because you've got world-class surgeons and honestly, you've got reps that are at such a high level. But so when I graduated, I came back on active duty. So, this is in 2007, I graduated and was assigned to Andrews Air Force Base in Southern Maryland. So I was assigned to Andrews. We had a pretty big orthopedic shop there. I want to say there were 5 of us, if I remember correctly. And then we had PAs that worked and we had orthotechs. And it was a pretty big base because we served the Pentagon. All the politicians would come to Andrews. And then they would also go to Bethesda. But for certain things, they would come to Andrews because we were the closest base to DC. You just had to cross the bridge and then come on over. So Bethesda was a little further. But when I first got to Andrews, you're right, there were some reps that weren't as experienced. And funny story, one of my reps from Andrews actually moved to San Antonio.
Oh.
And this is before I got to San Antonio.
Mhm.
And I ended up seeing him here in San Antonio when I got to BAMC. And I'm like, whoa, what are you doing here? So, but he's actually one of the reps that I started with in Andrews.
Oh.
And he was a young rep. I think he just came out of medical sales college,
Mhm.
and he was hired by a company and he did his sales training. But honestly, he wasn't an expert on the device.
Mhm.
And, I'll tell you, lucky for me that I did many, many joint replacements in my residency. So by the time I got to Andrews, I felt pretty comfortable. I could do any kind of joint replacement that I
Mhm.
needed. But, that may not be the case for all trainees. And, from a medical sales side, I think if you're a new rep, you should contact your surgeon ahead of time,
Mhm.
sit with them, have a meeting, let them know kind of who you are, shake their hand, explain kind of your background,
Mhm.
and be honest. That's like the biggest thing that I value the most is honesty in the operating room.
Mm.
So as a rep, like one of the things is never try to hide anything. Like if a piece of equipment is missing, you got to say it like right in the beginning. As soon as you call your surgeon, you face to face it, or you tell them. So, some tips, just be honest, say, hey, listen, I'm kind of brand new at this. Just be patient. I'm repping your knee replacement or hip replacement, and it's going to take me a little bit to get the experience, but I'm willing to put in the work and then willing to earn your trust. So, I mean, to me, that goes a long way.
Yeah. That's absolute gold right there. And for many years, I have heard, this drilled into many reps' heads is if a physician asks a question, don't shuffle your feet, don't sort of like dance around it. Just say, doctor, that's a very good question. I don't know the answer, but I'm going to find out for you. You know,
There you go. 100%.
and anything less than that, I've been told, is just going to end up in ruin because you can't fool them and you can't BS them. Or if you do, they're going to be really angry when they find out.
100%. One of the things is sometimes a surgeon will ask a question, they already know the answer, right? And they're
Mm.
just testing your knowledge.
Mm.
And honestly, if you make up an answer and it's just nonsense, there's a chance you've lost the surgeon's trust right then and there.
Yeah. Yeah. As I listen to you talk about what you're looking for from a medical rep, obviously being a subject matter expert on the product, just knowing it inside and out, the procedure and technique, all of that is that's just absolute foundational baseline. What are other things that you maybe once that's established that you like to see from medical reps? If they have that and they want to cultivate relationship with you. You're a surgeon, you're doing work, they want to sell more product and things like that. What are things that really help reps stand out once, if there's two reps in front of you and both of them check that box that's important for you? What are other things that help begin to develop that working relationship with you?
Right. So that's a fantastic question. Just in my field, so joint replacements, you
Mm-hmm.
have the choice of umpteen number of different type of joint replacements, right? So what makes one joint more superior to the other joint? So honestly, you have to believe in the joint that you're implanting. Like number one, you've got to understand that joint that you're going to put in somebody. In your opinion, in your heart, that is the best product that you can use. So I think that's the first thing is the surgeon has to believe in the product, and then that's half the battle, right? So if the surgeon believes in the product, now the rep comes in, and again, it's kind of an intertwined relationship, right? So you have to kind of separate a little bit that the rep is the device expert and the surgeon is the surgery expert. But if the rep can make it known to the surgeon or impress upon them that they are truly the expert
Mm.
and they can think outside the box, and then I'm kind of beating around the bush with this answer, but
No, it's good.
I'll tell you what my rep does currently.
Yeah.
So my rep is fantastic.
Yeah.
He actually started as a surgical tech.
Mm-hmm.
He was actually, okay, I'll tell you, he started in a doctor's office. Like his first part-time job, he worked in medical billing.
Okay.
And then he had other odd jobs growing up, right?
Mm.
He went into the Navy. He was a corpsman. I mean, I'm going to be talking about this, but you see how much I know about him, right?
Yeah.
So that should impress some of your device reps that are out there.
Mm-hmm.
So he's originally from the Northwest, lived in Arizona, and then he was a Navy corpsman. and then got out, and then he was a surgical tech.
Yep.
So that was his first job outside the Navy, right? So he was a surge tech.
Mhm.
I met him initially as a surge tech at one of the hospitals here, and I was very impressed with how he handled himself in the OR.
Mhm.
And every case was seamless. He knew the instruments. He may have not known the theory behind the instruments, but he knew what steps were, and he knew what to hand me. I wouldn't even have to turn my back. He just put it in my hand and I keep going. So
Mm.
he took the time to read my operative notes, believe it or not.
Mhm.
So he actually, the nursing manager, we have a pretty good orthopedic program, but they would pull the op notes,
Yep.
they would pull my preference cards, and they knew every single step. So he knew every single step and he knew what piece of equipment to hand me. So then after like a few years, then I said, hey, have you ever thought about being a device rep?
Mhm.
Right. So this is somebody who doesn't have the college background as some of your reps may,
Right.
but he has hands-on experience that really did it. But what really set him out was he was very polite. And if he didn't know something, he would figure it out. He'd figure it out on his own. When he got hired as a rep, he actually came to my office twice a week and we would prep for cases. We would run every single case.
Yep.
He would look at all the x-rays with me. So, I mean, putting the time and effort from a rep standpoint with the surgeon to prep your case, to know every single case that you're doing, even if the case isn't yours, right? So say if I'm doing a revision's a do-over surgery. So say if I'm doing a do-over surgery and I have to use another company and I'm not going to use his product, he was actually calling the other company, talking to that rep and telling them everything that I was going to do so that that other rep is prepared when he comes in.
Mhm.
So I think that's the level of, we're kind of meshed together, right,
Yeah.
in the OR. So I think if you're going to really get involved with a surgeon, you really want to have, some sit down conversations, introduce yourself,
Mhm.
be very personable, work on the relationship, but then also show that you're really willing to work hard, know your instruments, know the steps the surgeon takes, and then also prep cases with your surgeon. So I think to me, like some reps just show up, and that's not the rep that I want in my operating room, just the people that show up.
Right.
So the people that are actually calling you ahead of time and coming and doing case review with you, that's the rep you want.
Hmm. Yeah, this is just really, really helpful. And I know a lot of people are going to benefit from that synopsis because it's helping people understand what it takes to be great in your field. If this is a profession that you're going to take on as a medical device rep, we're hearing right now from, you're not going to appreciate this, but in my opinion, and from what I've heard, one of the absolute top surgeons in San Antonio, if not South Texas, about what great looks like from a medical device rep perspective. This is gold. A lot of companies, I'm going to go on a tangent here, not a lot, but some. And there's one big one in particular I can think of that have done some things in the last few years where they've tried to drop ship product in attempting to go repless and in order to maybe constrain some costs and cut down on costs. Do you ever see a day coming when there will sort of not be medical reps?
So, kind of what's happening in healthcare is the insurance companies and hospitals are squeezing. I mean, everybody sees it. They're squeezing the physicians and they're squeezing device companies on cost
Hmm.
because they're trying to lower how much they have to pay for implants, how much they have to pay physicians. And that goes across the board, I think throughout the US, insurance companies and hospital systems are kind of at that. But you're right. So some of the hospitals here in actually South Texas are starting to go repless, but
Hmm.
I haven't honestly seen that with hard products. Like soft products, yes. There are some soft products that don't really require a rep and they just put them on the shelf, like some of the bone graft products, right? You can rep bone graft, you can rep like suction bovies, you can rep other devices that don't really require the rep to physically be there because they keep the soft products on the shelf.
Hmm.
But the hard products, like when I say hard products, like your medical devices, your implantable devices, I actually don't see that because you have techs that work. So like surgical techs that work with the surgeons. And sometimes those surgical techs are fresh out of training.
Yeah.
They're not experienced. And you need the device rep to show the tech, hey, this is the first step. They have to set the instruments up. So I think for me on the hard product side, I don't think that we're going to go repless, but I am already seeing it on the soft goods side, right? I don't need a drape rep to come in.
Yeah.
I don't need a bone graft rep to come in, those kind of things.
Mm-hmm. Yep. No, that's helpful. Actually, really helpful. And it sounds like, anybody listening to this should be thinking about, how do I continually add value? What is my, what got me there may not keep me there. And I need to reinvent myself and continually figure out ways to add additional value when I have the privilege of being in the operating room and calling on surgeons. I do have a question that I think comes up from time to time, and I know it's in particularly newer reps' minds. If you know your stuff as a rep and you see a surgeon start to go down a path that you might say in your mind, I don't know that we're going to get the best outcome with that particular path. And you may never have had that situation, but if you have ever been approached by a rep in the OR who sees something developing, how do you like to be approached on that?
Right. So that is a fantastic question, because part of what I do a lot of revisions in San Antonio.
Mm-hmm.
So I take care of a lot of things that other surgeons have done incorrectly, and I've got to fix it.
Mm-hmm.
So I see things that, Jordan, boy, you wouldn't even believe some of the stuff I see. So I'm just flabbergasted sometimes. And like, it's funny, the relationship with my rep, if he covers other doctors, he'll actually take a picture during the case and send it to me and said, oh boy, we're going to have this one coming up. Right. So I always ask him, I said, hey, when you're covering other people and you see this going on,
Mm-hmm.
why don't you say something?
Yeah.
And here's the answer. Hey, Dr. Sayeed, we really try. And we stop the surgeon and say, hey, maybe maybe we try this or we try that.
Mm-hmm.
But, I think as a rep, if you actually see something that is incorrect, the surgeon is doing, or using your tool incorrectly, using the instrument incorrectly, you've got to speak up. Mm-hmm. Because at the end of the day, you actually, as a device rep, you have to go home too. Yeah. And if in your heart, you just kind of let stuff happen in the operating room, you're going to be partly to blame. But if you speak up and you say something, mm-hmm. and then the surgeon turns around and says, hey, be quiet, I know what I'm doing. Honestly, I think you've done your part.
Yeah.
So I think you've done your part. Mm-hmm. You spoke your mind. And if the surgeon doesn't want to listen to you, then that's on them. So that's how I look at it. But if you're open to constructive feedback, which all surgeons should be, because I think as a surgeon, some people actually, Jordan, you've heard of the God complex, right?
Mm-hmm.
Some surgeons feel like, hey, I am like number one in this operating room.
Yeah.
My word is gold. Whatever I say goes. But honestly, you have to look at it as a team, right? Mm-hmm. So that's how I look at it. I've got a nurse, I've got a tech, I've got an assistant, I've got a device rep, I've got a turnover team, mm-hmm. I've got an anesthesiologist. So you kind of, when you're in there, you have to look at things as a team, and your whole objective is taking care of another person. You're taking care of a human being, right? So if part of your team is saying something to you and you're not listening, then shame on you. Yeah. I think, my military days probably kind of played a factor in that, mm-hmm. just because I'll tell you, when you're deployed, you see things in the world that you'll never see in your life. And as a deployed surgeon, you have to work in a team, and there's no choice, right? So I think if you go about it and the device rep interacts with the surgeon and lets them know, hey, it's kind of teamwork, and then hopefully the surgeon sees it that way. But as long as you speak your mind during the OR, I mean, for me, just because that's my outlook, I look at it as a team, your input is very valuable to me.
Yeah. That has got to be the final word on our podcast today, because that was great. And I really appreciate you being on. My guest today has been Dr. Siraj Sayeed. And Dr. Sayeed, thank you so much for being on.
Yeah, Jordan, thank you very much. I really enjoyed it.
Thank you for joining us on the Chase MedSearch podcast. I hope that you gained some helpful insight from today's episode. If you enjoyed this episode, be sure to subscribe so you don't miss future episodes, and give us a like on your favorite streaming platform. It really helps grow our audience. For more information on Chase MedSearch, visit our website at chasemedsearch.com. Thanks again for joining us. Until next time, I'm Jordan Chase, and this has been the Chase MedSearch Podcast.